laboratory roles. So the role in the clinical lab and the employment outlook basically is what we'll talk about here. So we've got importance of the clinical lab testing. Obviously, we know it's essential for detection, diagnosis, and treatment of disease. Laboratory professionals collect, examine, and analyze these specimens, and then results are communicated to physicians or primary care providers to help in patient care. Employment outlook. Luckily, this profession is expected to grow faster than average, and this indicates a strong demand in job opportunities in the field. Some history of the profession. So we have the Board of Registry, or the BOR by ASCP. It was created back in 1928 by the American Society for Clinical Pathology. The purpose was to certify laboratory professionals. Individuals who passed the BOR exam were called medical technologists, also known as an MT, and they got to put the ASCP behind their name as well. And then we have American Society of Clinical Technicians, or the ASCLT, was formed in 1933. Today it is known as the American Society for Clinical Laboratory Science, or the ASCLS. In the 1960s, new categories of laboratory professionals started to emerge alongside the generalist of the medical technologist. So we have the medical laboratory technician, or the MLT category, and that was developed as a 2-year associate's degree program. Specialist categories were created in areas such as chemistry, microhematology, and blood bank. And then there were additional specialist certificates such as cytotechnology, histotechnology, lab safety, and molecular pathology. We have donor phlebotomists and phlebotomy technicians are also recognized as part of the lab team. We have pathologist assistants, and they represent another specialty certification. And there's also a certification as a diplomat in laboratory management as well. So there are some states as listed there. I won't read them to you, but they do require state licensure to work as a clinical lab scientist. And just as a note, if you decide to move to one of these states, you will need to have your national certification and a state licensure as well, and make sure that you are looking at the state requirements needed for state licensure, because they do vary by state of what is required. All right, so professional recognition. In 2009, our medical technologists, generalists, became referred to as medical laboratory scientists, or MLSs, which is what we are currently called. So a similar technical technician level designation continued to be designated as medical laboratory technicians, or MLTs. And then the appropriate professional credentialing is MLS with the ASCP at the end, or MLT with the ASCP at the end, depending on which level you are at. Continuing education is a requirement for certified professionals, and that helps to maintain your competence. Things are always changing in technology and healthcare both, so making sure that we have that continuing education helps to keep you up to date on what is happening in our world. In 2012, a doctorate for clinical laboratory science post-bachelorate degree was approved, and it represents an advanced credential beyond the entry-level generalist. It's kind of considered the terminal advanced practice degree in the clinical laboratory profession. The National Accrediting Agency for Clinical Lab Sciences, or NACLS, defines 5 core responsibility areas for your doctorate in clinical laboratory science, and that is patient care management, education, research applications, healthcare policy development, and healthcare services delivery and access. So staffing in the laboratory, so you will have a laboratory director, and they are typically a pathologist or a PhD, and they provide overall leadership and oversight of the laboratory. And then you have your laboratory supervisor or manager, and they are responsible for the technical management of the laboratory operations. They help ensure compliance with federal, state, and local regulatory mandates. They may work alongside as a business manager who can handle the administrative tasks as well. And then we have our clinical laboratory personnel, and they include our technologists, technicians, and specialists who perform, the daily laboratory work. So duties of the technologists, technicians, and specialists, they have all very similar duties. They perform various laboratory assays, supervise other laboratory staff, participate in teaching and research activities. Expertise, so they can possess in-depth knowledge of technical aspects, laboratory methodologies, and instrumentation, and they're able to correlate and interpret laboratory data effectively. Specimen collection, so while MLSs and MLTs may collect or process blood specimens, it's usually the phlebotomists that are going to do that. It's really just going to depend on where you end up working. Generally, in larger hospitals, it's going to be a phlebotomist. If it's a small hospital or a small outpatient clinic, it could be, the MLSs or MLTs that are collecting blood. All right, so then we have different laboratory testing complexity and personnel qualifications. So laboratory testing is categorized into 3 levels of complexity. Each requires personnel with different qualifications and responsibilities. So we need to make sure that we understand these levels. That helps to ensure accurate testing and compliance with regulatory standards. So the first one is we have high complexity testing. This involves tests that require significant judgment and interpretation. It often includes manual procedures or advanced instrumentation, requires personnel with extensive education and training, so usually MLS or equivalent. Technologists must understand complex methodologies, perform quality control, interpret results, and troubleshoot technical issues. I just want to make a side note on this one as well. So I said MLSs, but MLTs, depending on the state, can also perform high complexity testing as well. So just keep that in the back of your mind. So some examples of this include molecular diagnostics, cytogenetics, and specialized microbiology tests. And then we move on to moderate complexity testing. This includes tests that are more standardized, but still require some interpretation and judgment. This can be done by both MLSs and MLTs or others that have had specific training and experience. So testing procedures for moderate complexity are less complex, but still require knowledge of the equipment, operation, sample prep, and quality assurance. And examples of this would be like your automated hematology, chemistry panels, and some immunoassays. And then we have provider performed microscopy, or PPM. So this microscopy procedure is performed by the healthcare provider, usually like a doctor or an NP or PA during the patient visit. And this usually includes direct wet mounts, potassium hydroxide preps, pinworm exams, and other limited scope microscopy stuff. It's performed by trained healthcare providers, like I mentioned earlier, such as the physicians, nurse practitioners, or physician assistants. And it requires knowledge of specimen collection and basic microscopic techniques. Regulatory framework and personnel standards. So the Clinical Laboratory Improvement Amendments, or CLIA, regulate laboratory testing in the U.S. And this is under the 42 CFR Part 493, specifically Subpart M. If you wanted to read it, the website is there. But this details personnel qualifications for non-wave testing for that moderate and high complexity. So laboratories must employ personnel who meet education, training, and experience requirements for the complexity of the tests that are performed there. And we must also have continuous competency assessment, and proficiency testing is required to maintain quality and compliance. Then we have our lab personnel for high complexity testing, and our lab personnel for moderate complexity testing, lab personnel for PPM, and now we've got CLIA. So the Clinical Laboratory Improvement Amendments, or CLIA, were established to ensure the high quality and reliability of laboratory test results across the U.S. So one key aspect of CLIA regulations is the establishment of clear requirements for lab personnel qualifications, responsibilities, and training based on the complexity of that testing that's being performed. So the goals of CLIA personnel regulations is to ensure accuracy and reliability of the lab test results, protect patient safety by standardizing laboratory practices, define education, training, and competency expectations for laboratory employees. So CLIA personnel requirements overview. One, so scope of CLIA regulations. CLIA applies to laboratories performing basically any test on human, blood, urine, whatever. CLIA will oversee this. Responsibilities and training. CLIA regulations define specific responsibilities for employees depending on their role. So testing personnel are the people who are performing the test procedures. Laboratory directors and supervisors are the people who are overseeing the quality assurance and compliance of the lab. Personnel must have documented training and competency assessments to ensure test accuracy. There's also educational and experience requirements. So CLIA sets minimum educational backgrounds and work experience for personnel performing moderate and high complexity tests. Personnel performing high complexity testing must meet more stringent requirements than those performing moderate complexity tests. Examples of qualifications include degrees in medical laboratory science, specific certifications, or equivalent experience. There are levels of general lab testing. So laboratory tests are classified into 3 categories based on their complexity and potential impact on patient care. So we have waived, moderate, and high complex test. So the criteria for classification of test, the classification of a lab test into one of these categories will depend on several factors, and that includes the risk of harm to the patient. So tests that, if they're performed incorrectly could cause significant harm, such as, we give them the wrong result and they could cause a wrong treatment or a delayed diagnosis. Those are going to be considered higher complexity. Your lower risk tests are going to fall under that waived category. Risk of erroneous results, so the likelihood that a test may produce inaccurate or unreliable results. So tests with a high chance of false positives or negatives are usually classified in the moderate or high complexity as well. And then the type of testing method that is used. So tests using automated and simple techniques generally are going to be waived. The more complex methodologies involving multiple steps, manual techniques, or specialized instrumentation require classification as moderate or high complexity. And then we have the degree of independent judgment and interpretation that is needed for these test results. So tests that require expert analysis or clinical judgment for interpreting results are generally going to be higher complex. Tests that provide straightforward, objective results, positive, negative, with minimal interpretation are going to fall under waived or maybe even moderate complexity. Availability of the test for home use. So tests that are approved for home use are often going to be considered waived because they have to be simple and safe enough for untrained users to use. These tests require specialized equipment or trained personnel fall into higher complexity categories. So waived tests are laboratory tests that have been cleared by the FDA for home use due to their simplicity and low risk. So they will generally have a simple methodology. These tests are, straightforward techniques that are easy to perform and require minimal training. Low risk of error, so the methods are designed to minimize the chance of producing inaccurate results. Minimal patient risk, so even if performed incorrectly, these tests are unlikely to cause harm to the patient. And FDA clearance for home use, so because of their simplicity and safety, these tests can be performed outside of a professional laboratory setting, such as the patient's home. So an example of a waived test would be a dipstick urinalysis or a blood glucose. So importance of laboratory practice, like we mentioned, waived tests are commonly used in settings like physician offices, clinics, pharmacies, and even by the patients themselves, at their home. And this helps to enable rapid screening or monitoring with minimal regulatory burden. PPM, or provider performed microscopy, refers to specific microscopic tests that must be personally performed by a qualified healthcare practitioner, such as a physician, mid-level practitioner under the physician supervision, or a dentist. Key characteristics is, one is performed by that qualified provider. It can't be delegated to lab staff or other personnel, which makes it kind of tricky depending on where you're working. And then we have PPM tests are actually classified as moderately complex under CLIA, which means they require, a certain level of skill and judgment, which is why that provider has to be trained and have that skill to do it. Primary instrument for these are microscope, So it's usually a bright field or a phase contrast microscope. These are standard types of microscopes that are used, in every lab basically to examine the specimens. Labile specimens, so the specimens tested are labile, meaning they are unstable and can degrade quickly if not handled properly and promptly. So that's kind of why we allow the physicians to do that. There is generally no standardized control materials for these tests either. So sometimes, depending if you're working there, you may want to try to find something to do that, but a lot of times they don't have commercially made quality control. Limited specimen handling. So the handling of specimens is minimal, emphasizing the rapid testing to maintain that specimen integrity. Some examples of ppm testing would be a urine microscopic or urine sediment examination, a direct wet mount, a KOH, fern test, pinworm, things like that. So the importance of ppm is it allows healthcare providers to perform immediate microscopic examinations during the patient visits. It facilitates a quicker diagnosis and treatment decisions without having to send the specimens to a laboratory. So laboratory departments, organization of the lab. The structure and layout of a clinical lab is going to depend largely on lots of different factors, such as the size of the lab, the volume and variety of tests, the physical space and resources that are there. Are going to play a big role on that as well. So lab design based on space or size. Larger laboratories, they're going to have departmentalized structures. Larger labs typically have, distinct departments. Each area is kind of dedicated to a specific branch, such as hematology, blood bank, chemistry, things like that. It'll kind of depend on where you work. Sometimes they're mixed together, sometimes they're not. So smaller labs, they have a core lab design where, many labs are moving toward an open or core lab model where several related departments are combined into a shared workspace. And that could be an example of where they have hematology, urinalysis, and chemistry, all together. The benefit of this is it helps encourage better communication, resource sharing, and efficient use of space. And that brings up the importance of cross-training staff. So in the core laboratories, staff members are usually cross-trained to perform tests and tasks that are, that they could do in multiple departments. And then the flexibility, of course, the cross-training enhances workforce flexibility. It allows the lab to better handle fluctuations in workload and staff availability. Skill development, it also broadens the skill set of laboratory personnel, and it contributes to improved teamwork and operational efficiency. A working clinical lab is generally organized into several major scientific disciplines, each specializing in specific aspects of laboratory medicine. These include blood banking and, chemistry, cyto, heme, immunology, serology, micro, and urinalysis. The core lab model will combine routine testing areas into a shared workspace to improve efficiency and collaboration. Like mentioned earlier, sometimes hematology, CoA, chemistry, urine, those can all be together. This just helps, as mentioned before, streamline those workflows, a better resource utilization, especially if it's a smaller lab. Central testing areas in medium to large laboratories. So many medium to large size labs have established central testing areas, also known as core labs, like we mentioned earlier. These central areas house clusters of automated instruments dedicated to handling high volumes of test samples efficiently. Centralization streamlines workflow, improves turnaround time, and reduces redundancy by pooling those resources in personnel. It can support rapid processing and quality control for routine and specialized testing too.